When should you use PRP if you're trying to keep your hair or trying to help the results from a restoration? Well, we recommend it as a maintenance procedure even for people that aren't thinking about having surgery. Having a series of PRP treatments, usually done 1 month apart, is going to help nourish the scalp and keep the hair growing and keep the scalp nice and healthy so that you diminish the amount of hair that's thinning out and falling off. Now, PRP is platelet-rich plasma. It is the stuff that we get when we draw your blood, spin your blood in a centrifuge, separate out the cells, and then isolate just the plasma. And the plasma has a high concentration of platelets. The platelets have a huge amount of growth factors and other cellular messengers like cytokines that will help nourish the health of the skin that we inject it into. And we inject the PRP into the scalp. That really boosts the health of the scalp, boosts the health of the follicles, and helps the hair grow thicker and fuller. That's great as a maintenance and preventative procedure, but if you're having surgery, we highly recommend it 1 or 2 weeks before surgery to give you that boost right at the time of surgery. Then at the time of surgery, we use PRP to make sure all the grafts are really sustained well. They get the benefit of having that PRP on the day of the procedure. Then we're going to follow you 1 month later and give you your last PRP treatment that can really help the overall process and maintain good early growth and healthy growth of your new hair. So whether you're doing it as a preventative or maintenance procedure or using it afterwards just to boost results and maintain good results, PRP can be a great tool in hair restoration.